Global health authorities are sounding the alarm about the rapidly spreading Ebola outbreak in the Democratic Republic of Congo. The head of the World Health Organization says the outbreak is far from being contained and could spread internationally. Over 5,000 cases have been confirmed, along with nearly 2,500 deaths. Making matters worse are issues like poor health infrastructure, regional instability, and resistance to aid efforts in many communities.
As if the outbreak weren't difficult enough to combat on its own. Matters are being compounded by locals who are scared and distrustful of the health authorities.
Yesterday, one of our ambulances was attacked here. One of the ambulance of the response operation was attacked here, in Bunia. And we are really extremely, very regularly challenged by these situation, by these attack on healthcare services.
Another complicating factor is that doctors don't yet have an approved treatment method for this particular Bundibugyo strain of Ebola.
We don't have a vaccine to deploy. There are things being tested, but we're not at the place where we have approved things to use. And that obviously makes it tricky. You're really just trying to get people to treatment centers so that they're not infecting other people. And of course, supporting them with supportive care. And when they're in those centers, they have a much greater chance of survival.
So far, the outbreak is consistently outpacing all efforts to contain it.
The speed and growth and spread of this outbreak is much, much bigger. It's much faster and spreads much bigger than the outbreak in 2014 or the outbreak in 2018. It's horrible for families. We see family members that come in who have had 15 people in their family die. We rapidly need to scale up to be able to prevent more deaths from happening, more families and communities from being impacted.
The location of the outbreak is also worrying experts. Situated along the borders with several countries, including Uganda and South Sudan, observers fear the outbreak could cross over. So far, at least, that doesn't seem to be the case.
Ebola is not yet in South Sudan, but we must do everything in our preparedness to prevent Ebola from entering South Sudan.
But for now, say experts, the focus remains on finally getting ahead of the outbreak in the hardest hit areas of the Democratic Republic of Congo.
And for more, let's get in touch now with Anastasia Sholinok. She is spokesperson for the Norwegian Refugee Council in the DRC. How are you seeing the situation in the eastern DRC right now?
Yes, hello. The situation right now is very complicated. As you might have seen, the number of positive cases of Ebola are only increasing, so meaning that the outbreak hasn't reached its peak yet. Also, we are more than 2,000 confirmed in the epicenter of the Ebola outbreak, mostly in Ituri province, which is located in eastern DRC. And the situation is very preoccupying because everyone has the impression that we are not able for now to catch up with the outbreak path, and we really need to try to increase the level of response overall.
How is the ongoing conflict between government forces in the DRC and various militia groups impacting the Ebola response?
It's very important to note that in eastern DRC we have more than 120 armed groups. Therefore, we don't have one only conflict going on in different provinces of the DRC. Therefore, the situation remains quite volatile. The different conflicts evolving differently as well. And therefore, it creating a sense of insecurity. Obviously, sometimes the population is not able to access any healthcare facilities. And a lot of population is also being displaced, sometimes at multiple occasions in eastern DRC. And some of this population are forced to flee their homes, leaving their livelihoods behind them, leaving all their belongings. And some of the population is forced to also live in overcrowded camps, in which obviously it's very difficult to put in place any kind of preventive measures in terms of Ebola measures overall.
We've heard about the fear that the outbreak may cross borders, including, the borders with Uganda and South Sudan, which neighbor the DRC. How are you seeing the measures that are currently in place? What is being done to prevent that from happening?
I couldn't really say anything about the neighboring countries such as Uganda or South Sudan. I know that the response here, at least in Eastern DRC, is making all it's possible to try to prevent the outbreak to expand. It's very difficult to say what is happening in neighboring countries because I'm not working there. But I know that there is a coordinated response that are trying to be put in place to prevent any further spread of the outbreak.
What is the Norwegian Refugee Council doing right now specifically? Can you tell us a little bit more about your efforts to help contain the outbreak and to support the population?
Yes, so NRC, Norwegian Refugee Council, has been present for more than 25 years in DRC. And right now, the different locations, including in Ituri province, where most of the epicenters are located, we are scaling up our operations in different kind of locations. So for instance, we are working in schools where we started to put in place some preventive measures to make sure that schools remain a safe space and that the education is not disrupted. So currently, for instance, we're preparing for the start of the year, which is going to start on 1st of September. Also, we have some interventions in internally displaced population camps. So there we're also making sure that the population has enough clean water. We're putting in place water and hygiene and sanitation measure in place to allow the population to take also preventive measures to allow them have a decent level of hygiene overall. And also we're supporting different health facilities in total, we are covering 55 health zones in Ituri province, for instance. So we're also supporting health facilities. And overall, it's very important for us to engage very closely with the community, also relying on some community leaders, religious leaders, and so on and so forth, to make sure to communicate about the risk of around this Ebola outbreak, but also to inform the population about the measures that the population can take to prevent from the spreading of this particular disease. So we are mostly relying on the communication around the risk involved around Ebola, just to name a few.
Thank you so much for that overview. Anastasia Skolenok, spokesperson for the Norwegian Refugee Council in the DRC. We appreciate you joining us here on DW.
Marcella Cray is Emergency Coordinator for Doctors Without Borders. She joins us from Bunia in the DRC. Welcome to DW. Sadly, this isn't DR Congo's first Ebola outbreak. Why is this one so hard to contain?
Good evening. Yes, I think there's several reasons for that. One of them being that this is a different variety of Ebola than we've seen before. Before we had the Zaire variety, which has a vaccine. Right now we're dealing with the Bundibugyo variety, where there's no vaccine yet. So that's one reason why it's very hard to contain.
Okay. And what sort of challenges, what are the challenges facing efforts to contain it?
There are many, many challenges. First of all, the east of Congo is a very complicated context with a lot of violence, different armed groups, a lot of conflict going on. So that already makes a situation where it's very difficult security-wise to move around, both for interveners like Doctors Without Borders, but also for patients themselves. Besides that, there are a lot of socioeconomic problems, a lot of poverty, a lot of just things going on that make it difficult for people to seek healthcare. A third reason we can see is a lot of distrust, misinformation around Ebola. It's a little bit similar to what we've seen in Europe with COVID, where there's a lot of social media posts saying Ebola doesn't exist, or it's coming from foreigners, or it's a business model. So, of course, that's also not helping in stopping the spread of the disease.
Right. And you guys, you're out there in the community trying to do this with all that going on?
Correct. Yes, so we have different kinds of activities. We have Ebola treatment centers where confirmed cases of Ebola are treated, but we also are supporting a lot of health centers where people with symptoms that have not been tested yet can get care. And what we're trying to do is we not only offer Ebola care, but also care for other diseases, because as you can imagine, there are a lot of other medical needs as well. Right. And with that, actually, we're getting closer to the communities, which is to some extent helping us to be more trusted and gives people easier access to Ebola care as well.
Right. So if there is no vaccine, no cure, what care are you able to give?
So basically what we're doing is it's the body itself that fights the virus, the Ebola virus. But the symptoms make the person very weak. They get dehydrated. There's a lot of other symptoms that go on. And so what the treatment consists of is actually symptom treatment. So it means we can hydrate the body, for example, do everything we can to make the body as strong as possible. And the problem is that people are coming in late. They become very weakened, and that stops the body from being able to fight the virus.
Right, okay. So, and you're doing that in the face of the misinformation and a war going on. But as you treat people, is the word getting out that this is indeed what we need to do? We need to find these doctors, find these medical centres and get treatment there?
Yeah, I want to believe, and I think that's what we see as well, that slowly, people are realizing again the gravity of the situation. It's not the first Ebola outbreak in this region, so it means that people are somewhat aware. But as more cases are popping up, and indeed the epidemic is spreading very fast, we're seeing more and more people actually coming. But at the same time, there's just also a lot of fear. People are worried that they actually do have Ebola. Another problem is that the symptoms of Ebola look very much like other diseases like typhoid or malaria. So, again, one of the big problems we're facing is people, when they do come for healthcare, it's often late.
Now there is talk of this outbreak becoming international. Do you see that as likely?
Well, for the moment, it's really in a relatively remote part of Congo. So in the whole region here, yes, within the country of Congo, a few cases popped up in Uganda, but since they were very limited and the Ugandan response was very, robust immediately, they are now without cases for quite some time already. So they have declared their outbreak over. So for the moment, no. Of course, you never know, right? But I think the remoteness of this area is, in that sense, helping. And it's a bit different from 2014 in West Africa, where there's international movements going on.
Right. Thank you so much for joining us and explaining that to us. We wish you well with your work. Marcella Cray from Doctors Without Borders.
Thank you.